The most important technique for preventing and controlling transmission of infection is hand hygiene. Hand hygiene refers to the use of antiseptic hand rub, hand washing, or surgical hand asepsis. Performing hand hygiene properly and consistently is not optional. It's a critical responsibility of all healthcare workers. To begin, push your wristwatch and long uniform sleeves above your wrists. If you're wearing rings, remove them before performing hand hygiene. If your hands are not visibly soiled, use an instant, alcohol-based, waterless antiseptic rub. Dispense an ample amount of the product into the palm of one hand. Then rub your hands together, covering the palms and back of the hands, interlocking your fingers and cleaning the thumb areas and finishing with your wrists. Continue to rub your hands together until the alcohol is dry. Allow your hands to dry completely before you apply gloves. If your hands are visibly soiled, you'll need to wash them with soap and water. Again, keep your nails smooth, filed, and short, no longer than ½ centimeter or about ¼ inch. Then stand in front of the sink, keeping your hands and uniform away from the surface of the sink. If your hands touch the sink during the hand washing process, repeat the sequence. Now, use the faucet handles to turn on the water. If it's a pedal-operated faucet, depress the foot pedal or push the knee pedal laterally to regulate the flow and temperature of the water. Avoid splashing your uniform and make sure the water temperature is warm. Thoroughly wet your hands and wrists under the running water. Look for breaks or cuts in the skin and around the cuticles, keeping your hands and forearms lower than your elbows. Apply 3 to 5 milliliters of antiseptic soap and rub your hands together. Using plenty of lather and friction, wash your hands and wrists for at least 15 to 20 seconds. Interlace your fingers and rub the palms and the back of your hands in a circular motion at least 5 times each. Keep your fingertips pointed down to facilitate the removal of microorganisms. The area beneath the fingernails harbors high concentrations of bacteria. Clean under the nails with the fingernails of your other hand, using extra soap or use a disposable nail cleaner. When you've finished washing, rinse your hands and wrists thoroughly. Keep your hands down and your elbows up. Thoroughly dry your hands from fingers to wrists. Use a paper towel, a single-use cloth, or a warm air dryer. If you use a paper towel, discard it in the trash when you're finished drying. Then use a clean, dry paper towel to turn off the faucet. Be careful not to touch the handles. If the faucet has a foot or knee pedal, use it to turn off the water. If you are not returning to provide patient care, you may apply lotion to your hands. Use the lotion provided by your facility. If lotion is not provided, choose one you like, but avoid using a petroleum-based product.